On this episode of the Ask Mike Reinold Show, we talk about some of our strategies for dealing with people that are struggling to regain their motion.
The Ask Mike Reinold Show. Helping people feel better, move better, and perform better.
Before we get to the podcast, I wanted to make sure you knew about my free online course on the introduction to performance therapy and training. If you want to learn how to get started optimizing and enhancing performance, this is the course for you. Head to mikereinold.com/performance to sign up today. Welcome back, everybody. The latest episode of the Ask Mike Reinold Show. We are up in Boston, the crew here from Champion PT and Performance, answering your questions, anything you want to talk about. Ask away. Head to mikereinold.com, click on that podcast link, and you can fill out a form to ask a question that hopefully we'll get to and answer on one of these future episodes. So let's see. I am joined here today by the crew, Dewesh Podell, our strength and conditioning guru on the Zoom call here, Lisa Russell, Dan Pope, Lenny Macrina, Mike Scudo, Dave Tilley, all here answering your questions. Again, anything you guys want to talk about in terms of, physical therapy, sports performance, career advice, anything, we're here for you. Len, looks like we did some round robin chair shifting again. What do we got today?
We got a really good crop of students this week compared to last week. Batting leadoff, Chris Afonso. They call you Fonzie?
The Fonz.
Quite obvious. They should call you Fonzie. Yes.
Why haven't we yet, by the way? We have, that's like a definitive
I was just
nickname.
sitting there staring out at my window, which is my garden outside, and I was thinking he should be called Fonzie. Zach Leal from NYU, and we have Ben the Fisherman Fisher from University of Kentucky.
I mean, easiest group of nicknames. Anybody with a Z is always just Z. I mean, that's an easy
Right.
one. And then, I mean, Fish, that's like the best.
Fish. Yeah.
I mean, that's pretty good.
And Fonzie.
The Fonz. Hey, we got to do that every time after we say it. So, all right. So that's what we're going to do in the clinic. So anytime anybody calls them the Fonz, everybody else in the room has to go, hey, and do that. Right. All right. Let's look that up on YouTube. Make sure I'm pronouncing that well.
Let's really hope that doesn't last for more than a week.
Or like
that's lasting. That's lasting.
I think a lot of people are confused right now that people know who the Fonz is.
That's okay. I don't care. You know what? I'm thoroughly entertained, and I think we nailed it. Awesome. All right, what do we got, Fonz?
Hey.
Jeez, man, the first time and you guys didn't even do it. Let's try that again. I feel like I'm with my 8U softball team. I'm like, I didn't hear you guys. Are you excited? What do we got for today's question, Fonz? Hey.
So James from Maryland asks, what would you recommend for a patient having difficulty maintaining the range of motion achieved during PT sessions? They are still waking up in the morning with little to no range of motion, and a short time after their PT session, they stiffen up and lose the range of motion gained during the session.
Nice. That's a good question, James. That does happen a good percentage of people that have loss of mobility, right? That we see that. And I think that's probably the one thing that people probably get the most frustrated about as a physical therapist, right? Is that, you're working with the person, you're making some gains, and then they come back the next day and they're tight. So, interesting. Who wants to start with this one? This is a good, diverse group. Dan, why don't you start it up while the others gather their thoughts? I just wanted to say that.
Kind of curious what he's talking about. Is this like a post-op patient, or is this someone who's just trying to gain mobility for like a sport or something? I guess what I will say is that I think as a profession, we don't often do the best job of making like an evidence-based stretching protocol or mobility protocol. There's so many weird ways out there to try to gain mobility, and we do have a decent amount of research about what tends to work, and then also the dosage that works, right? So I kind of compare it to like a diet. People come up to you and say like, I tried a diet and it didn't work. It's like, well, did you weigh yourself in the beginning and then at the end? What'd you eat? Did you eat broccoli? Did you count your calories? You're like, oh, well, I didn't do any of those things, So sometimes I feel like people don't have a good protocol that has stretching, let's say 5 days a week, 60 seconds, on a given muscle, maybe eccentrics 2 to 3 times a week, 1 to 2 sets, 5 to 10 repetitions. And then they need to be able to make sure that they're measuring at the start and the end, right? So I think that's probably the most important beginning, is like make sure you're measuring. And then on top of that, make sure that you're applying a good program. And I think the other piece is that you have to wait long enough, because a lot of these changes are short term, right? If I go like this, 10 times per my arm overhead, I probably just increase my range of motion, but then 10 minutes later, it goes away. If you look at some of this research, people aren't making a change until they get to like the 4-week mark. So part of it, I think, is that, it's kind of like trying to gain muscle mass. You have to look at it that way. It takes a period of time to make these changes. So measure, good program, and then if it's not changing, then modify, right? I mean, we always do that. If you're not making the change that you want, maybe you need to add more, add another exercise, change exercises up, and just keep troubleshooting over the course of time.
Nice. Good stuff, Dan. And you started that off with kind of talking about like the different types, and I think that's pretty good. I like that. I'm thinking that through a little bit, because I'm trying to think of like all the different types of people we would have with that. But Lisa, what do you think?
Yeah, I mean, I feel like I have a lot of rowers come in that are just like, they have a really hard time getting going in the morning, right? Because a lot of us get up early and roll out of bed and just kind of try and move. So like the simplest, like less than 5-minute warm up of just like moving your body around and not just forward and backwards has gone a long, long way for a lot of people I've worked with. Just because, it has to be short and sweet so that they're going to do it before they get on the water. And I've had a lot of people with back pain or knee pain or hip pain or this or that, just like be amazed by what 5 minutes of just like basic mobility and like some glute and core activation before they start like working out does for them. So I feel like the simple things go a long way, more often than I have given credit for in the past.
Yeah, and you could
Sounds
probably
like a blog
take
post for Lisa.
Yeah, right. The simple things. And I think when you educate people that, when you try to make it like a part of their life, like Dan kind of said, right? It's always easier like when you're in pain, but when you're not, you fall out of it, right? Who else wants to jump in?
I would also say,
Oh,
go ahead, Mike. Yeah,
oh,
no,
wow.
Mike, no.
Master
No,
Lenny,
I speak
Master-
enough. I
Please.
speak enough. I speak enough.
Mike's hand went up first.
Yes, exactly.
Yeah, okay. I definitely have patients that get a little bit stiff. No, I'm just kidding. But if we're talking about a post-op patient in this question, and they're waking up with little to no range of motion a short time after PT, I may be taking a step back and wondering if there's a pretty big inflammatory process going on. Does this person have any underlying autoimmune disorders? If they're really struggling to regain motion and if they're losing it, maybe we want to look elsewhere. But my strategy as a physical therapist would definitely be to increase the frequency of motion. I think frequency over intensity. If they're not working on motion multiple times throughout the day, that would be my first step, and probably working at a lesser intensity. So maybe we're just going to a 2 to 3 out of 10 intensity for active assisted range of motion. And if they're still making no progress, then, maybe we start considering other factors.
I like that too. And the more flared up and annoying that motion loss is, probably the more frequent but less intense you want to do it. That's actually a really good tip. That's pretty helpful. What do you got, Len?
Well, so I was going to say, kind of allude to what Mike said so eloquently. It was amazing how you just worded that. But you got somebody in PT, we work on their motion. Let's for example, you work for them for an hour, right? 1 hour is your PT session. There are 24 hours in a day. So they have 23 hours of doing something. If you divide 1 into 24, you get a number. I think it's like 5%, something like that. There's 95% of their day that they need to do something. So they need to do something more frequently, right? Like Mike said. So it's up to you to reinforce the home exercise program. Get them moving, easy boats throughout the day. That's what I do with my ACLs, especially to work on knee extension. They are instructed to at least work on 4 times a day their knee extension for at least 15 minutes at a time for a 60-minute dose. So it's something similar to that. They need more frequent bouts of a home exercise program, a regimented home exercise program. You got to sell the home exercise program to them, that it's important. This is why, this is what you need to do, how frequently. And I check in with my people. I texted one of my new ACL patients I texted her on Saturday. She didn't get back until Sunday, because that's what kids do nowadays. They ignore their text messages. And I checked on her to see how she was doing and how she was working on her emotion. So it's little things like that I think, again, to set you apart from other PTs in your clinic or in your area, that you are enforcing your programs, and that's going to get you better outcomes, and then word spreads, and then voila.
I feel like, Lenny, as you're getting older, you need to adjust to the communication streams of the modern youth. I can't wait to see you like film like a TikTok dance while you're asking, how's your range of motion?
Exactly.
And that I think I would pay to see that. I think that would be really
We
good.
need a Snapchat filter of something. I don't know. Is that
Is that
Snapface?
is that still cool?
InstaChat?
Instaface.
What up, Mike?
Yeah, I was just going to say, going back to Lenny's comment, I know we often talk about low load, long duration stretching, particularly in the need to regain extension, trying to accumulate 60 minutes a day. I will use low load, long duration stretching in other joints as well, particularly in the shoulder. If they're far enough out of like a labral repair with a capsular plication or capsular shift, and they're having trouble regaining external rotation range of motion, I'll do a low load, long duration stretch into ER, just letting gravity kind of pull their arm back, potentially with a hot pack on the front of their shoulder, trying to get the capsular creep kind of back and regain motion from a capsular perspective. So that's another strategy that you can try. Also, bracing and splinting could be something if they are losing all their range of motion and you want to maintain to help supplement your mobility and stretching routine.
Yeah, especially if they're really struggling there too. So I guess I would say this. I would say is I think we have to understand the expectation of the specific person in front of us. And I think a lot of people alluded to this in some of their answers, right? But let's just talk about like motion as a capacity, right? So if this is like your full capacity of motion, right? And you have an injury, you have surgery, and you're under that capacity, you're trying to raise it back up to where you were, right? And sometimes surgically or inflammation, et cetera, that becomes a little bit more challenging. That's the more frequent, less load type motion. I think a lot of people get frustrated when they see somebody completely healthy or pain-free. Let's say like ankle dorsiflexion, they see on one side is less than the other one. They have no problems and they're trying to raise their capacity. So not just like get them back up to their baseline, but to get their capacity higher. And I think oftentimes you got to realize, like, this is a great example. Like you have a 65-year-old patient with low back pain that can't touch their toes. I mean, man, they've had 65 years of neglect of not being able to touch their toes. I don't think you giving them a couple of stretches is going to be super impactful on their life, right? So I think you got to kind of be careful, with that sort of thing. I can't touch my toes. I've never been able to touch my toes. I don't think I'm ever going to be able to touch my toes. Like it just is what it is to some extent. So if you're trying to raise somebody's capacity, I think my expectations are often lower than somebody that's just trying to get back to their neutral, I would say. Luckily at Champion, I think we see kind of like a hybrid more than anything else. We see athletes that perform a task, right? And this could be anything. It doesn't have to be an athlete, but you perform a task and then that task gets you tight. Like that day, like you just go throw a ball, you just ran a sprint, right? And then the next day, your hamstrings are tight, right? Great. That's easy. That's the easiest one for us. That's transient tightness that we can address almost immediately and have a very impactful change in that session before they leave, right? And that's the one that's a blast. So don't confuse that person, right? Where their hamstrings are tight because they just ran sprints yesterday and you restored their range of motion and it stuck and it lasted, right? Because they didn't run again. That's a great success. Don't compare that to then a 65-year-old with low back pain that can't touch their toes and you're struggling to get their hamstrings more mobile. I just think it's an unfair fight for you, right? That doesn't mean you can't. Like Dan said, it's going to take months, right? It's going to take months of hard work to get that going, to raise the capacity level. So I think I would just say that, is that not everybody's the same, James, and you gotta kind of like have realistic expectations for the person in front of you, I guess, based on where they are with their motion. Okay. Makes sense. So awesome. Great episode. Good answers from everybody. Thanks, everybody. That was awesome. Appreciate it, James. Thanks for submitting that question. If you have one like that, head to MikeReinold.com, click on that podcast link, fill out the form, ask away so we can have more chats like this. We really appreciate it. So, but again, we want to see those reviews on iTunes. Jeez, I'm more out of touch than Lenny. I just said iTunes, right? That's great. On what is it, Apple Podcast now? We don't see those reviews on Apple Podcasts, Spotify. Can you do reviews on Spotify? I've lost focus. Anyway, give us some reviews because we read them and that gives us feedback on our future episodes. So thanks again. I'll stop talking. See you in the next episode.